All right, it says we're live. Hey, everybody. Thanks for joining us this afternoon. And if you listen later and tune back in, I'm really excited about this conversation, and it's definitely worth spending a few minutes. Whether you sit and listen and watch us, he's got some great charts and things he's going to show, Dr. Jason here, or just to listen in. I'm really excited about what we're going to discuss. So this afternoon, my guest of honor is Dr. Jason Regis. He is a chiropractor in Marietta and has started or owns the Transformation Wellness team there. And I met him through PowerCore. Like 18 months ago, a year or two ago.
Yeah, past 2 years ago.
So I told him, we're going to give him the floor in a second, but kind of how this conversation came to be was that we met, we did PowerCore. If you're not familiar with that, it's like a networking group, and you go around and everybody, shares for a minute about their business. And so I learned and kind of got tidbits of information about his specific chiropractic care. And then while we were still in the apartment, before we moved into our house, our little pup, Maggie, who's getting older, jumped off the couch. She always does it, but this one time she tweaked her leg, and it had gone on for a couple weeks, and she still wasn't better, and she was pretty sore. So we were talking about the vet and had been told for a long time that surgery was going to be an option eventually. And so we were kind of scared that it was kind of time for that. So fast forward, or rewind, I guess. And I was like, wait a minute, I think Dr. Regis talked about treating pets. And I was like, why not take Maggie? This is like an easy first step. If we can avoid surgery at all costs, let's go see what this chiropractic care and pets are about. So Maggie's sleeping in my lap, but today she's joining the podcast because she was actually his first patient. And so funny story was we took her, and it actually did help and improved her a lot. She literally had traveled crooked her entire life since she was a puppy. We would walk her, and her little back legs would trail behind her front, but they would be crooked. And every time after her adjustment, or since her adjustment, she travels straight, which is crazy. So her front feet, trail straight behind her back feet. And then just this morning, actually, she did something because she's getting old and she forgets that she's getting old. So she threw herself out again playing, and was sore for a few days. So we went in and had an early visit, and she's been sleeping and relaxing and is back to being active this afternoon. So Dr. Regis, would you like to just introduce yourself to everyone, and then we'll see where the conversation goes.
Sounds good. Well, Dr. Jason Regis, owner-operator of the Transformation Wellness team, started as a brainchild a while ago about, first of all, treating people well and listening to them, but then also encompassing all the different facets of health. So here we have chiropractic, we have acupuncture, we have neuromuscular therapy, we have nutritional counseling, we have cold laser therapy, we have a spinal decompression table, as well as physical therapy traction. So we encompass all that, as well as personal training for the whole body, because wellness doesn't come from one place. We believe that it takes a team to get you well, as well as we don't call our clients or patients, we call them team members, because you're an active part of the process. I say it's kind of like you have a personal trainer, and I can give you a great workout, but then you're going to eat McDonald's 3 times a day. You're not going to get to your... So I like to give homework to all my team members to help keep them better. My goal is to get you better as quickly as possible, and you go tell everybody else. And that's how we get our referrals.
Awesome.
A little bit more is that my background is a little bit different from the average chiropractor, and that I worked in physical therapy, is actually researched and published at NIH by the time I was 22 years old. Also have a master's in sport health science, focused on sport injury management, and also was a personal trainer and certified conditioning specialist. Division I athlete, and out of the 13 possible problems with spine, I've had 11 of them by the time of age 18, but never had any surgery, including for torn ACLs, broken wrists, broken shoulders, double scoliosis is actually how I got into chiropractic. But it takes a village to keep me together, and I like to be part of your village too.
That's awesome. And I think that speaks a lot to chronic health problems or joints and stuff. And rather than go to surgery as the first option, chiropractic care can really bridge that gap and bring healing. And it doesn't mean that, surgery isn't necessarily completely avoided, but, it can at least put it off longer. Hey, I just want to say we have a number of people tuning in, and I can't see who is there. I just see numbers. And so if you guys want to give a shout out in the comments, that would be awesome. Then we could reach you by name. So Maggie, I was so impressed with Maggie's little transformation in her legs. We even took her to the vet. And she's like, well, I'm like, well, she's improved. We've been seeing this chiropractor, and he kind of put her back in line, and she's actually improved a lot. And the vet was like, don't even worry about it, because that's a really invasive surgery. So do physical therapy. There were options. We ended up never having to do physical therapy. And she's going on 12, I think. Like, dog's old, and she acts like she's a puppy still. So that was like huge for us, huge for me. And so I have a joke. My husband and I actually have been seeing, going to chiropractors about once a week for a couple of years. And they're kind of the drive-through places where you go and get like the typical routine adjustment. I have my hips. You could probably speak now better to what exactly is going on, but I really thought it was my hips that were out of place. And so, especially when I'm active and start moving a lot, like I would have this chronic pain. And then even at times, like I would be a shooting pain down like above my left hip in my lower back, completely random. But it's like somebody shoved a knife in my back, and it was super painful. So I got to thinking, I was like, well, this, in and out place isn't necessarily, it's temporary relief, but this pain is still here. So it's chronic. It's something that I know has been a problem since probably college when I was running a lot. And so I went over to Dr. Regis's place, and I'm like, heck, if I can resolve this chronic issue, then it's worth a shot. So I went and saw him. I posted the video. Apparently I was a lot worse off than I realized. It was quite the first visit, but the biggest thing we found was that my hips were actually jammed. And that was caused, if it would have been just left that way and not untreated, it would have continued to cause degenerative
disc disease.
There you go. Hey, Michelle. And so it's been, and no, truth be told, it's been a month, I think, since that appointment. And I haven't had any of those sharp pains again. And I haven't had to have my hips put back in. So that's good. So I would love to just start like we can discuss maybe, because that video was posted before on my page. So kind of, you talked about what you were doing in that video, but other ways or other connections that we don't think about, like when you're adjusting, you say, if you don't adjust this area up here, then you're not getting a full adjustment with your neck. Right. So just little things like that.
Well, so many places I can go from here. We can talk about symptoms. We can talk about the evaluation, how it's different. We can talk about my knowledge base. When I was in chiropractic school, I went to Life University, best school in the country, most hands-on learning was the reason why I chose that school. You start really putting your hands on bodies, students, of course, at the very beginning, as opposed to some chiropractic schools where you do more towards the end of a 4-year program. It's actually shown that chiropractors go to more schooling than medical doctors. But my professors, especially the ones who work in the sports field, would always talk to me differently. They would say, okay, well, you do this adjustment, you're going to move this bone. And they would say, and Jason, remember those rotator cuff exercises for the shoulder that you learned in physical therapy? That's when you do the exercises. So it made a lot of sense to me, because the muscles are attached to the bones. That's not something that's up for debate. And so you can move the bones, all day long, but if you're not addressing the muscular component, you're not going to get the full effect. And so as part of the evaluation, for example, what's going on with you is I have a little model of the spine here. I didn't clear this with you, and I'm trying to get this. And so this is from the front to back. Okay. So as I'm sitting here, this is what I'm sitting on. And with you, this is the hip socket right here, where your femur, your thigh goes in. And what happened with you, Tessa, is that your hip was pulled into the socket there instead of having space. And that's what eventually leads people to get hip placements over time. There's a muscle that attached to that. I'm not giving away all my secrets today, but the muscles are attached there. So sometimes even where you're feeling the pain isn't really where the problem is coming from. And I think, as you might know, that over time and years and all the different exercise programs, there's certain exercises that will help, that will actually exacerbate that pain and cause it worse, including sitting. And so one of the things that I coach people on is what to do and what not to do, or when to reintroduce it as we go along. So I have an NFL player that started coming in to see me at the beginning of this, he was supposed to go back earlier, but because of these current situations, he has actually 2 extra months to spend with me. And he says he's been to hundreds of chiropractors. And I said, well, what's different about, well, I said, what's different about me? He said, well, it's your evaluation process. And, he has access, he has the money, he's had the massages. He hasn't said he hasn't had a massage like he's had here, even though the other NFL player that referred him to me actually paid $500 for a massage. He said it wasn't good for as good as the $85 one he had here. And so as part of the evaluation process, I look at the muscles, and that's where that team member and the homework comes about, is I address all of that and then also give you some things to do outside of the office to help keep you better and keep you out of here and coming here without pain.
Yeah. So so you have you kind of approach chiropractic as the whole body. And Absolutely. I will say that the adjustments, the drive-through versus the adjustment, weekly adjustment or whenever, that's all on a plan and per patient basis and how often you need to come in. But the adjustment that I get when I go in to see you is, I would say, more complete. So it's kind of like going through the drive-throughs at McDonald's and then going and sitting at a nice meal and having the whole experience. If we're going to relate it to food, drive-throughs and that. So what are some of the common myths and misperceptions that you hear from people when they, when they're in conversations with you about your care and what you do, or chiropractic in general?
Well, first, that we're all the same. Especially when I have them hold their pinky and thumb together to see how their carpal tunnel region and the nerve supply is going to their arms. Wow, nobody's ever checked that before. And, alluding to your comment before about looking at the whole body and treating the whole person, I also like getting to know people as well, because I need to know if you're going to go visit grandma, for your Florida visit. I'm going to say, okay, hey, remember to stop every 2 hours and do a couple stretches. Even just walk around the car so you set those muscles, and then you end up being because you don't want to get all the way to your vacation and then have pain. Yeah. So I say treating the whole body is important, because if you don't adjust these joints here, they attach to your neck to here. So it's kind of like washing a car without washing the windows in my book. So the car's not really clean, and you want to get the full picture, so to speak. So, people say they can crack their own backs. I can crack my own neck. They tell me. And that is not chiropractic. Chiropractic, by definition, is done in a periphysiological space where we take the pressure off the nerves. And periphysiological space in layman's terms means a range of motion. So for example, I can turn my head this way, or if I relax and I had somebody else turn it, I can get a little bit further. It's kind of like you can't tickle yourself. Yeah. If you can, you have problems. That's another whole subject. So that's where the adjustment happens. And there's actually been people who have injured themselves trying to adjust their own necks. Now, chiropractors, people say, well, chiropractors hurt people. Now, the average medical doctor pays about $350,000 a year on malpractice insurance. Okay, chiropractors for the same coverage pay less than $1,000. Especially in this litigious society, if we were hurting people, number one, I wouldn't be doing it, and number two, we'd have a lot higher. Everybody guesses $750,000 to $1 million when I ask them the question on the first visit. And we also do things to make sure that we rule out any type of issues where we wouldn't adjust you. We also have different ways of adjusting. You don't always have to be cracked or hear the popping sound. That's just air escaping from the joint. It's not the sign of anything moving. I'll do an evaluation of somebody, and they'll have 5 bones out of place, and they'll instinctively crack their neck, and I'll check again, and they have 7 bones out of place in their neck, just like that. And then you also have the ligaments, which are like taffy. And so if they stretch out, they don't get tight again. So you want to have very specific adjusting. And for me, the adjustments take 10 to 15 minutes. You go to those drive-through places, 1 to 2 minutes, you pop, you might feel good for a second, but it's not really what you need. But also a tool called the activator, which is why I used on Maggie today. Yeah. So it's actually $800. So, but you just spring loaded, and that can actually move the bone just like that. So it doesn't have to be any type of thrust or force. And one reason I went to Life is because they have so many different techniques that everybody's different, and not everything works on everybody. So that's why you have to take the time to get to know somebody, get the comfort level, or even get the experience. But chiropractic doesn't mean with hands, and we move the bones and take the pressure off the nerves.
Very good. We're getting, Michelle said she loves that thing. I love this. We're getting some questions. So I wanted to touch though real quick before I get to Hazel ask about vertigo. but you mentioned that when you hear the cracking noise, it's air coming out of the joint versus like you're adjusting for relieving pressure on the nerves.
Correct.
And so why would it be important that we relieve pressure on the nerves?
Great question. Well, I like to tell people that I'll adjust your symptoms, okay? Symptom based. It's kind of like if you have a check engine light in your car and it's blinking red and you just put a black piece of tape over it, okay? So it's not blinking anymore, but the problem's still there and it's going to get worse, right? So it's very important that we don't look at symptoms. And so I have a chart here, which maybe Tess will upload later. It's called a dermatome chart.
Yeah.
Blue actually comes from your low back on this side over here.
Okay.
If you look where the blue corresponds here, it actually goes down to your legs. So you can have a knee problem and you can take those anti-inflammatories. You can do physical therapy on that knee, but guess what? The problem's not coming from your knee. And this is not something that chiropractors make up. It's called a dermatome chart. You can look it up and notice also that when people get shingles, it's always along a dermatomal line. It's all along one of those lines. And every time somebody comes in here with shingles, they always have that bone out of place. Okay. 10 times out of 10. Okay. So we don't want to focus just on the symptoms. We want to actually look at the root cause. So Dr. DC, Doctor of Chiropractic, stands for Dr. Coach as your team member, also Doctor of Cause, looking at the cause of the problem, not just the symptoms.
Very interesting. Shingles and chiropractic. That is definitely one I would have never like correlated or made that connection. So that's really interesting. So how does, because I've heard like for kids and stuff that have chronic ear infections or chronic sickness, like chiropractic care is important. And I wonder how, because that's ears. And from my understanding of vertigo, it's inner ear. And so how, if someone comes in and has vertigo, how do you treat that patient?
And I was looking at that question on the side. I was like, please ask me that question. And I'm gonna go around the bend first. And I was digging my drawer because I have this medal here for a lady who finished her first marathon, which was great. And I was explaining to her how my kids, I had a picture of little small ones of them. I have shown them too. They graduated now. But the point is that I explained how my kids don't get sick. My youngest two have never had an ear infection, never had strep throat, none of that stuff.
Wow.
And so I mentioned this to this lady. She said, "Oh, my kids get strep throat 7 times a year." I said, "That's a lot." She said, "Yeah." She says, "They're scared to get tubes put in their ears in 3 weeks." I said, "Well, give me 3 weeks." And so she would bring them in. There was 3. There was an older, who's the same age as mine, who's just graduated from high school, and 2 younger boys. And so I would say, "Okay, bring this one back here." She brought them back the day before they were supposed to get the tubes put in, and took them to the doctor. The doctor said they don't need tubes anymore.
Wow.
Okay, so one of them got a little head cold in the first year. Now she's 18. Now it's been 5 years, and none of them have gotten sick.
Wow.
Okay, so there's a definite correlation. And also, I'd like to tell you that the first chiropractic adjustment was actually done on a man who was deaf for 17 years. So chiropractic started September 18th, 1895. A man named Harvey Lillard was crawling through a small space underneath his house, heard a pop in his back, and he lost his hearing. Founder of chiropractic was studying people's bones and their necks, and noticed that people with smooth necks actually live longer, were healthier. People with bumpy necks, bones out of place, had more issues. And so he called him into his office, checked him out, adjusted the first bone in his neck, the atlas, which is right underneath your skull bone, your occiput, and he got his hearing back. And that's how chiropractic was started.
Wow.
So,
that's cool.
Yeah, let me grab this real quick.
Hey, and I just want to thank everybody that's watching and people that are leaving comments and checking in. We really appreciate it. So if you have any other questions or for Jason, Dr. Regis, give a shout out. Okay.
So vertigo. The blood supply from your heart to your brain goes to the neck. The only place that has these horizontal framing, I know I have a lot of models, but you can look this up and I'm practicing here. So through the hole here, this is the only place in the body that has horizontal framing. And that's where the blood supply goes from your heart to your brain. So when your bones are out of place, it will stop the blood supply. So headaches, migraines often also help with chiropractic care. Now, I'm not saying I'm curing anything. I'm not saying I'm treating anything. I'm removing the interference from the body, letting the body heal itself and function properly. So with that blood supply being kinked up, it's kind of like a water hose, somebody stepping on it. And the pressure off the bone we move the bone, we take pressure off the blood supply as well as the nerves in the body. Now, one of my specialties, I want to call it, is extremity adjusting, which is adjusting your shoulders, your wrists, your knees, head to toe. I do it all. Especially because if you think about like people who have knee replacements, ankle issues, even toe problems.
Mm-hmm.
Think of your body and your hips as your car and your alignment. If your alignment's off, your wheel's going to wear away faster. So if you're putting 20 pounds more pressure on one leg than the other, one leg shorter than the other, I'm not talking about like 1/16 of an inch, not a big deal. But if you notice that your pants are having to be pinned, half, quarter of an inch, think about it.
Wow, yeah.
And so there's that. But this joint here your ST joint, sternoclavicular joint, is the only joint that attaches from the is the only thing the shoulders connect to in the body. So that's why the rotator cuff muscles are important to help keep everything back, because there are 4 muscles that actually join right here and they hold everything back. And so I've had people that have gone to other chiropractors before, especially after a car accident, and they're getting adjusted. And I know some of the chiropractors, they do a good job with the spine, but they're not getting this joint adjusted. And they go for MRIs, CAT scans. They can't find anything, and they start getting this adjusted, and it all alleviates.
Clears up. And so this being adjusted is attached to vertigo or your ear?
Yeah, all the above, because your cerebellum, if you look at the brain here, this yellow part is the cerebellum. So that's part of your brain stem. Okay. The first bones, your occiput, your C1 and C3. So we call it the master switch. Half the nerve of your brain located right here. So if your occiput's out of place, which is where this muscle attaches to, it's called the SCM, sternocleidomastoid. Sterno, which is your sternum, cleido, clavicle, mastoid being the mastoid process as part of your occiput. So when that is kinked up or subluxated, then you'll have pressure there. And so you'll notice with people who tilt their head a lot, that's your body's righting reflex. Your body wants to keep your eyes level with the horizon at all times, but it'll start compensating when you have certain things subluxated, there's pressure on those nerves.
Oh, that was me.
Yep. You're straight today. Maggie is too.
So that's so interesting. And I saw some chiropractors in college, and I've seen a couple others over the years that weren't drive-through places, and we did x-rays and that sort of thing. But I don't remember ever either like checking the hip joints like we did, or being, well, I won't give it away. Shocked. When your hips are jammed. But especially like in every adjustment, like checking this collarbone area and having this adjusted. And so that's been really, really interesting. But clearly, after you explain it, like so vital to the rest of this, and it makes sense logically. And I do like listening and kind of pulling in the conversations of the month have just been on health, and how, when I started the idea of doing these lives with professionals and was to just get new ways or alternative ways that we can boost our overall body's wellness and immunity to improve our health overall, but especially in the face of, COVID in the world and colds and sickness and cold season's around the corner. Once we get through the summer, it'll be here again. And so rather than just go and pop a Tylenol because I have a migraine, or go to the quick care clinic and get an antibiotic when I'm sick, like what if I could prevent and actually let my body heal, rather than just, be in the game of, well, when I get sick, then I'll treat it. And so actual healing. And I wonder or if there's a story about some swelling or inflammation, because removing inflammation from the body, from my experience, has been key to staying healthy and not getting sick with those chronic, colds and viruses that go around, because my body's not already inflamed, and colds cause inflammation.
Right, exactly. Dr. Healy Self, and nutrition is the most important thing in all of this, really. Your water content, because your body's 75% water, so are your discs. So having the right amount of water is very clean, clearing the spine. But yes, inflammation is huge in the body and in our society in general. That's why we see the whole push, and people drink a lot of alkaline water, because diseases are hard to thrive. They're very hard for them to thrive in alkaline environments. But acidic environments, which is caused by sugar, milk, even the president of Johns Hopkins came out and said that after the age of 2 years, we shouldn't be drinking milk, cow's milk. We're the only species that does that, but I'm going to leave that alone. And I'm not going to say ice cream is bad or anything like that.
Cheese away from them.
I know people are quitting on us right now. But no, but things in moderation,
Yeah.
and nobody's perfect. So, but the point is that there's a feedback cycle from the body. It's called the safety pin cycle. So whatever you put in, it's going to travel through those nerves and go to your organs. So even looking at this chart, which is the autonomic nervous system, all these nerves go from your organs all the way to the spine. And so they actually did an autopsy on 235 bodies. People died from different organ deaths. And 273 out of 275 cases, there's a pinching of the nerve at the spinal cord level. Wow. So when we talk about inflammation, we talk about what we're putting in the body nutritionally, and the body will react to it for sure. I have a team member here. I'll show you some before and after pictures. And this is without any type of exercise, but she told me she wanted to go on an anti-inflammatory diet. Mm-hmm. Before that, this was her ankle.
Wow.
Yeah, so 6 weeks later, just by getting rid of Diet Coke alone, and this was her ankle.
Wow. And it looks like her skin color too.
Oh yeah. She's actually now lost 60 pounds.
Yeah.
Over the past year.
Okay.
So yeah, inflammation is really key. And that's why I also talk about not adjusting symptoms. You might have swelling on your left ankle, and you can put ice on it. You can do physical therapy. However, there is a bone that goes from the ankle all the way up, and that's where the fluid can get trapped. So when you release the bone, the fluid can relax. I had a team member that had 3 surgeries for spinal degeneration and had that swelling. He'd been taking the medication for 6 months, and he came in to get adjusted, and it went down in 30 seconds. So you can see some of these pictures on my website also, which we'll get to later. Yeah. But inflammation is very key. Also, in terms of if you have a pocket of swelling, let's say a bone is sticking out and it's sticking out like this on this side, the swelling is going to accumulate on the opposite side. So again, that's where the pain is, but not to say where the problem is coming from.
Interesting. That's really, really cool. We had a question. Joe asked, because I don't want to forget the questions. Joe asked how frequent someone should see the DC while training for a half marathon.
Okay, love that question. Marathon season. It will be soon. Trust me.
It will be soon, right?
It depends. I don't have a cookie cutter approach to anybody because there's a lot of different factors to how long you can hold your adjustment. I always sleep well at night because I tell people what to do. So you're soaking, he said for a half marathon. Yeah, so you're soaking how much you're stretching, because some runners aren't good at stretching or stretching the right muscles. Depends on if you have a knee problem going on, ankle problem going on. The average person, I believe, needs to get checked every 2 weeks. Okay. Now, training for a half marathon, let's say you're going from doing the couch to 5K or do something like that, then I would say come in weekly at first so we can check and see and make sure you're not running. Because again, that knee will wear out if your hips are off. You're putting 10 pounds more pressure. You do that for even 10 miles, that knee is going to pound, the ankle's going to pound. And then also one of the things I work with runners is plantar fasciitis and IT band tendonitis. There's a bone in the foot called navicular bone, and that's what can be plantar fasciitis. You have over 639 muscles in your body, and you have over 100 in your feet alone that affect the whole rest of your body. So there's a bone embedded in there that needs to be addressed, as well as particular stretch, which is not usually addressed either. So I'd say for a marathon with some training, I would say come in, every week to 2 weeks. But if you're new to it, I would come in every week.
Yeah, and especially when you're running, because that repetitive motion, if something's out of place, like I've been walking, jogging a lot of miles the last 3 months, and that was part of the problem. Was all of a sudden I started moving so much more. We were traveling, so it was 10,000 steps a day. So when I kept that up, and there's hills where I live, and so the pain was just obnoxious. Like it started hurting enough to get me to want to gain relief or find a way to heal. So I'm really thankful that I did that. But I think that, and you've been good at encouraging, because Michelle asked about what can you do between visits to prevent re-injury. And so this morning you asked me, so how are those visits going? So accountability there is good. A reminder.
Yeah. But I'm bad you beat you up about it.
No.
I choose different spots to ask, so it's different.
But you've been, that's part of, I guess, just your typical care. and like that team atmosphere, like you're in with the, playing it on the same team as a patient. So you want their success. And so after an adjustment, like you're giving, like reminding that soaking is important, reminding like, hey, you should try, you're tight here. Like, here's a stretch you can do at home, or even your office or, office, you do a rehab room. And so you have patients come in and there's like spinal stretching things in a wobble machine and a wobble chair and different things to help loosen up the muscles in the body before the adjustment. And I think that I make up that would help hold the adjustment longer. If my muscles are connected to my bones, and if we can relax the muscles prior to an adjustment, then it's gonna like be loose and relaxed for the adjustment.
Right. Exactly. I mean, let's take that a step further. And let me also add that I have a cross-country runner that would come in every Friday, and every Saturday he would get a personal record for 6 months. And I have an NFL player that went from running a 4.78 to a 4.63 in 2 adjustments. So when your hips are off, it actually costs you a quarter inch in your stride length every time. So you put that over the course of half marathon or whole marathon, that's minutes on your time that you could be improving. And then back to your question was about, tell me what it was again, one more time, the original question. Okay, so just talking about how the alignment goes with the spine and the feet and ankles, it all really goes well together. And with the rehab room, we're not adjusting, or we're not, addressing the muscles. We're doing more so the ligaments. The ligaments attach bone to bone. And spinal degeneration comes a lot of times when these bones are out of place, and then they start rubbing against each other, and then that friction causes, think of it like a piece of chalk against a chalkboard. Eventually it's going to wear down the surface. So you have more space in between the vertebra with the discs. And so what these cervical traction units do, the wobble chair as well as the neck strap, is it helps to loosen up the ligaments and helps pump the spinal fluid through the system. And that makes the adjustment hold better, as well as it's easier to move the bones. Very little force is used when the body's prepped properly. And so, you go to a physical therapist, and one of the reasons I started taking x-rays here, I take digital x-rays, which have less radiation than going through TSA at the airport, is because I'm starting to see degeneration in 13-year-olds with necks fused together, all this tech neck that you see, especially now with the Netflix and computer consumption for the past couple months. And what would generally happen is I would tell somebody, you have degeneration of spine, you should come and see me every 2 weeks, and they will take 6 months, and they get in pain, they go to the medical doctor, and they say, hey, I have degeneration in my spine. I said, yes, I told you that. And they say, well, what are we going to do about it? And they'll go to physical therapy, and physical therapy will charge you sometimes $100, $200 to do what I'm including within your adjustment. So, and we also encourage people to take these items home with them so that they can help do their homework on the outside. There's a picture on my website of a naked, of a lateral cervical. And this man actually got adjusted 8 times before he went out of town for a month. And he had a reverse curve. He had a phase 3, bones about to fuse together. And he just took it with him for a month, came back. We re-x-rayed him just without adjusting him. And he already started getting his curve back.
Wow.
So it's really, the end all and longevity of the spine, not just the absence of symptoms that we're looking at.
Yeah. And I think that the powerful thing is I hear in that, and the fact that like, if we, of adjustment or of treating the root cause of our pain, right, of the bones are out of place, like they're about to fuse, like what can we do rather than going in surgery and fuse them, or going in surgery and like you have no more disc left. Like if you just give the body what it needs to heal, it's incredible. Our bodies are made to heal. And I think, anymore, I feel like we've forgotten that.
Yeah, it's hard with the programming, with everything that's on TV, and especially now with even the social media generation, where we want everything yesterday, and we don't want to work for it. I keep joking that we're going to have a wellness pill. You just take it. You don't drink water. You don't have to exercise. You do yoga. Just take this pill, and you'll be okay.
Yeah, but it's a little bit more work. Like it's long term. Like short term gain or pain, maybe even like the pain of actually having to show up and do the work and be accountable to like doing the next exercises or the stretches on the door. But the long term pain of that is like not having to do surgery or have my hips replaced at 50. It's preventing that chronic pain that I don't want a hip replacement.
No, look at it like a piggy bank, that you're putting money into that you can cash in later, So it's not about how you feel now at 30 or 40 or 20. What do you want 60, 70, and 80 to look like?
That's a good point.
You don't just start stretching when you're 70 to be flexible, Start now and build on it. And nobody says you have to do an hour and a half of yoga every day, but even if
Mm-hmm.
you start with 2 or 3 minutes,
Yeah,
it's beneficial.
true story. Okay, so a couple more questions. Are you ready?
Yeah.
Okay, so hypermobility, I'm gonna get this wrong. Ehlers-Danlos syndrome. What do you know about this? And how can chiropractic care help, or can it help?
Okay, I have actually a couple people with that, with Ehlers-Danlos syndrome, hypermobility of the joints. Yes, and that's where I think sometimes chiropractors can get a bad rap, because if somebody tries to adjust somebody that in the wrong fashion, it's just going to create more mobility. So that's where some activator is really key, for using low force and very specific adjusting for that. Definitely a different technique is needed than what's needed for that football player or the average time runner.
Sure.
But then what I also like to do with that, especially when anything is systemic, is we consult with our naturopath here and find out what we can do as far as joint stability, whether it's fish oil, whether it's CoQ10, and I'm not talking about the generic brands that are out there. I'm talking about a grade that you can only get from a licensed professional, to help support those structures and those nerves, those ligaments, those joints, and be very specific about how we're treating them. But also, somebody like that, we start slow. The same way I would do with, I had a 96-year-old team member here, and we didn't just start adjusting their bones manually. We start with the activator, see how they react, and then move from there.
That's cool. So, and again, it goes to say that it's not like a one adjustment. Like my husband and I, for instance, walk into the drive-through and we both lay on the table and we both basically get the same, like literally the same adjustment. It's going through a checklist and marking the boxes. And like I told you earlier, I confessed, confession time. I know, ended the contract, right? So I had one more adjustment left and I was like, he was going, I was like, why not? So a few days ago, and interesting enough, they, and I'd complained before, I didn't mention this, but my wrist, doing planks or push-ups and stuff, I had wrist pain. And so they tried to adjust and like shake my wrist, but nothing ever really like resolved it. Well, I think, and my elbows, I've never had anyone set my elbows or reset my elbows. But today, like my ankles, like all sorts of things down there in the deep ankle region, needed alignment. And you found that today. And that's just, I think that's, speaks to the individual and the time you take, but also the fact that it's not like a one size fits all. And all that's probably helpful to a certain extent. What's harmful for me was that they continue to overlook like the underlying problem of my hips being jammed and that sort of thing was still there. And that wasn't being addressed. It's it would have caused long-term, problems and complications. We have another question about inversion table. Is it safe to use an inversion table? And if yes, should you use it after your body is warmed up or before? So I guess, does it matter if you're warmed up?
Well, I asked the same question as a personal trainer because actually somebody gave me an inversion table and I had it in the gym. And then what we have here is a spinal decompression table, which actually you lay flat on your back, and you can either for your lumbar or your low back or for your neck, cervical, and your mid back region. So when I asked him that question, he said, no, inversion tables aren't good. One of the reasons is because you hang upside down, and while you're hanging upside down, like this, actually like this,
Yeah.
this part is stretching out as far as your low back, but all the rest of the fluid is compressing the rest of your disc at the top. So it actually can cause more problems. I mean, it definitely gets some relief. It's better than nothing. And some people say, oh, I feel a pop. Again, that's not an adjustment. That's just air escaping from the joint. So, yeah. So, I mean, they're good, I would say. I mean, they have some benefit, but they're not going to really give you the space that you need. And you should definitely limit the time that you're on there and more than like not go all the way, vertical. You should have a little angle so all the blood doesn't rush to your head completely.
Thank you. And so I don't know that we have any other questions. Are there any other myths you'd like to bust?
Let me see. Well, in terms of the crack and go chiropractors, that's your word that you use the first time I mentioned the drive-through. I have 6 friends that own some of those clinics, and all their wives come to me to get adjusted. So that should tell you something. As well as, my training from one of the chiropractors who works for 8 of the NFL teams. His techniques was worth $10 million, and he just took a liking to me, and I was underneath his wing for 18 months. learning from him. But I really, one of the other misconceptions that people say is that I don't want to go to a chiropractor because if I go, I'm gonna have to keep going. And the way I liken that is to two things. Like, you don't go to your dentist one time in your life and you stop going to the dentist.
Yeah.
Same thing with your car. You don't just get a tune-up once a year, get your oil change once every couple thousand miles. It also depends on how you treat that car as well. So again, the absence of symptoms doesn't mean that you don't need the care. As well as looking at the body as a whole, you want to really get specific with the issues and not adjusting the actual the symptoms. Again, the pain, discomfort. The ankles are your foundation, your extremities. And so some people ask me, especially when it comes to insurance, because as we all know, insurance deductibles have gotten a lot higher, and they'll say, well, just adjust what my insurance covers. And ethically, I can't do that. It's like your ankles are your foundation, your feet are your foundation. So I can't adjust your hips and not adjust your ankles. It's kind of like building a house on sand. So that's something that you would do. And so I address everything and I check everything every single time. So really the myth of chiropractic is that you do need to go, you need to be regular. How much you go, some plans better than no plan. I always encourage people to be proactive rather than reactive about their health.
Yeah.
Don't wait. Problem. We don't wait till we have a heart attack to start exercising. We don't wait till we have a cavity to start brushing your teeth. And I'll tell you what, it's a lot easier to replace your teeth than to replace your spine.
That is the truth. I think that's a good point. And the proactive, like, that's the whole thing. Like, what can we do proactively so that we're not reactive? Because reactive care, I mean, you'll end up in the hospital or in surgeries, or like the cost of that too is significant, not just monetarily, but to your body, longevity, and your overall health. I love that you mentioned, like, think about where you want to be. It's not about today. It's about 20, 30, 40 years, when you're retired and elderly, like what kind of body and functionality and life do you want to have then? Because you only get one body.
Yeah.
So you only get one body.
Take care of it.
They haven't figured out how to replace spines yet, and I don't see that in the near future. So it's important that we take care of it. Well, I just want to thank you for sharing so much knowledge, a wealth of knowledge. We've had, I think everyone has been really appreciative. They really enjoyed the conversation. So two things that are in my head is, so if we're local to Atlanta, we're lucky enough to be in the area of Marietta. Then kind of give a reference point to where your office is located for the locals. And then also, if I live out of town, how would I go about finding, is there what do I need to look for, questions to ask to find another chiropractor that's going to give similar care?
Well, first off, I would say that sometime I have a lot of people that travel from out of state to come see me. I have people that drive from Alabama and they'll come get adjusted and they'll go right back afterwards. And that's also why I have very flexible hours. I usually start at 7:00 in the morning and I finish at 8:00 at night. And I have Dr. Brian as well here, who I've trained over the past year with some of these techniques. So you can follow, our website is www.thetwt.com. Follow us at Transformation Wellness Team, and our Instagram is at @TWT_Marietta. Finding a chiropractor out of town, that is very difficult. Of my, 12 years I've been a chiropractor, of the 50 people that I've recommended out of state, I've had 2 success stories. Because a lot of people say they'll do the extremities, like the ankles, the wrists, and they don't. They only do it if you complain about it, and then they don't do it well, from what my team members tell me. So, for example, that marathon runner who had the records every Saturday, he just waits till he comes back home. He actually left for officer training school yesterday to join. But yeah, so I'm really proud of him. But it's difficult. What I found is the best way, and the way I start searching on the internet is looking for a Brimhall chiropractor. BRIMHALL. Okay. That's a technique that encompasses the whole body. They talk about nutrition. They talk about cold laser therapy. They work on the extremities. They also use vibration. And so it's also included here. I did my thesis on vibration therapy. So looking for a chiropractor who at least is looking at the whole picture is your best bet, and finding somebody that's going to look at your whole body as well as all the different parts of the body.
Excellent. I think that's helpful. So Brim Hall.
Brim Hall, yes.
Okay. Yeah, because it's tough. I know we've got someone from California and Texas and Virginia, I think. So we have lots of advocates.
There's another one, kinesiology. I look for a kinesiologist because when I do muscle testing, which is testing your body's awareness within space, your proprioception, similar how you almost step off a curb and you sprain your ankle, but you bring your ankle up really quickly. There's a little thing called Golgi tendon organs, which attach the muscle to the bone. When they lengthen, the body thinks it's going to tear when it gets to the end, so it shortens really quickly. That's why bouncing and dynamic stretching that's not good for your body. And I have a YouTube video about that. But kinesiology, they're doing the muscle testing like you saw in your video post Facebook, where we actually test the joints, and looking for somebody that's doing that kinesiology is another good way. And that's also including Brim Hall, of course. But if you can't find that, look for a kinesiologist that's also a chiropractor.
Excellent. Awesome. Well, thank you. I'm going to leave this up on Facebook. I think you're going to share it on Facebook. And there's also going to be all these videos I've been uploading to YouTube and then embedding them into one page. So that's at tessamarie.com/wellness. And so that gives just kind of a one-page place where all of the different conversations about health and boosting our immunity and overall wellness can be found. And then I'll make sure and link to your website and Instagram and share information of how people can get in touch with Dr. Regis as well. So thank you, everyone, for being here and tuning in. We really appreciate it. And for those of you that watch it later, we appreciate you being here. And if you have questions, feel free to reach out to either of us directly. Have a good day. Bye.
Take care. Bye.